Hello everyone, welcome in this live session. Arjun mentioning good afternoon sir. Good afternoon Arjun, how are you? Good afternoon Nishant. Good afternoon Satish Kumar. Good afternoon. Good afternoon everyone. If you are doing preparation for psychology entrance exam, you already know it's not an easy path. It takes time, it takes focus and lots of mental strength. But if you are still here, if you are doing preparation for this exam, studying, trying and not giving up, that means you are you are a person or a student who are serious about their goals. And that's something to be proud. Psychology is about we all are aware, understanding people. And during this journey, you are also learning a lot about yourself, how to manage anxiety, stress, and how to keep going even when this exam is tough, and how to stay focused when distractions are everywhere. There will be days whenever you will do preparation, whenever you will move with the preparation. So there will be days when you feel tired and when you doubt yourself. Everyone goes through this particular condition and situation. The important thing is not to stop. Keep doing your best. What you are aspiring, just move in that particular direction. You are not just doing preparation for this exam. You have to understand that you are getting ready to enter in this particular field in mental health, in psychology, where you can truly help others. And society need more people who care, who want to understand and who are willing to listen, right? And you can be one of those individual, one of those people. So take a breath, stay calm, keep working toward your goal and keep one thing in mind. Always you have to keep this thing in mind that you don't have to be the best person, best individual. You don't need to perform best all the time, but you need to be consistent all the time. So focus on consistency. Don't try to be best all the time in all the situation. And yes, you are doing better than you think. Sometimes we doubt ourselves that I am not better than other individual. I'm lacking behind. But believe me, you are doing better than you think. And you always maintain consistency. You don't need and we don't need to be best in all the situations. So let's move here. You can see again, we will discuss 10 questions. We have already completed question number till question number 40. So we will start from question number 41. If any individual joining this session first time, so you can visit and you can get a look into those live sessions that we have completed, right? So Nikki, hello Nikki, hello Nishant. Nishant mentioning, sir, I want to study from you for M.Phil. When your batches will be started? So Nishant, every month we are starting at least one batch. We are trying to start one. So in April to I think next week we are just going to begin a batch. So you can contact to the team. I hope you are having contact info. If you don't have, you can search on website, search on internet, you will get those. Pinka mentioning good afternoon sir. Good afternoon Pinka. Nikki mentioning answer. Mathvi mentioning answer. Arjun saying thank you sir for valuable words. Welcome Arjun. I know, right? We all, specifically you, whenever you are doing preparation for this exam, we are having so many problems, so many issues, not only related to study, right? We are facing so many issues related to so many things, because cracking any entrance exam is not only about reading and studying. Cracking any entrance, right, is about so many things, right? Handling anxiety, handling stress, handling family situations and other things that happening around. So whenever we are doing preparation, I know we need someone who consistently can motivate us and who consistently can guide us, because I was in those situations where I was in that particular situation where you are right now. So I can understand all those problems, all those dilemma that we are having. Let's begin. And if you are having any suggestion, anything, any question, you can mention in chat box. Here you can see question number 41 mentioning, A young adult exhibits excessive emotionality, attention-seeking behavior, and rapid shifting mood in social settings. Which personality disorder is most likely? Option A mentioning narcissistic personality disorder, option B borderline personality disorder, option C histrionic personality disorder, option D antisocial personality disorder. So if you know the answer, you can mention in chat box, and many individuals mentioning their responses like Asha, well done, creative hacker, well done, creative hacker mentioning सर मुझे पीएचडी इन साइकेट्री करना है तो मैं एज प्रोफेसर टीच कर सकती हूँ क्या? प्लीज रिप्लाई. सो क्रिएटिव हैकर, यू आर joining us with this name, so sorry I am repeating this name again and again. So if any individual want to be a psychiatry, so yes, there is a certain path after getting license of psychiatry. Yes, we can teach, but there are certain term and condition we have to understand. One thing we can do, you can call to our team. They will definitely guide you and help you understand what is the difference between clinical psychologist and psychiatry, how you can be psychiatry, what is the path of being psychiatry, what is the path of clinical psychology, be a clinical psychologist. They will definitely help you out. So, okay, I'm coming back to this one. Correct answer is C, histrionic personality disorder. Here you can see correct answer is C, histrionic personality disorder, right? The key feature is excessive emotionality. Whenever we are talking about histrionic personality disorder, the key feature of histrionic personality disorder is excessive emotionality, attention seeking behavior, and rapid shifting mood in social setting, right? These are the hallmark trait of histrionic personality disorder. So individual with this disorder often display dramatic and theatrical behavior and crave approval and attention. They always having desire to get attention. In all the situation, they want attention, and when they are not getting attention, then they feel uncomfortable, right? So correct answer will be C, histrionic personality disorder. Question number 42, here you can see, during a crime investigation, a witness incorrectly recalls seeing a knife in the suspect hand after being asked, did you see the knife? Which memory error is most relevant here? Option A, kleptomnesia, option B, misinformation effect, option C, tip of the tongue phenomenon, and option D, encoding specificity, right? If you know the answer, that's great. But you can try answering in chat box, in comment box. Definitely I will answer them. And whenever you are mentioning your answer, if possible, try to mention question number, so I will get to know, like, okay, you are answering question of this one or previous one. Okay, Sanjukta, you are mentioning your response, and yes, you are right. Bhavarthni, no, I am taking a wrong name. Ramesh Kumar, right? You are mentioning correct. Well done, Arjun. You are mentioning one thing that I always repeating. No matter we know answer or you are aware about those concepts or not, at least we are learning here. That's why we all are here to learn something. So correct answer will be B, misinformation effect. Now the question is, why misinformation effect will be there? So the misinformation effect occurs when a person's memory of an event altered or misleading, or right, they are getting certain, what we can say, suggestive information, and then their memory will be altered, right? We can take one example. Whenever any individual is the eyewitness of any crime, and in those particular crime, criminal doesn't have knife in their hand. But if we are asking this question to eyewitness, like, did you see the knife? This cause false memories to be formed. In this situation, whenever we are suggesting question, did you see the knife? ऐसे कंडीशन में मैं पूछना क्या है, right? ऐसे कंडीशन में we have to ask कि उसके हाथ में कोई weapon था, but we are asking, did you see the knife? So whenever we are presenting this kind of question, whenever we are suggesting something that can lead false memory, individual can creating false memory or can create false memory, so we can say that is misinformation effect. Correct answer will be B. Question number 43. universal factor of snakes' heights explained by cultural learning, B. reward conditioning, C. Preparedness theory, and D. James Lange. Question is, universal fear of snakes' heights explained by option A. cultural learning, option B. reward conditioning, option C. preparedness theory, option D. James Lange. If you know the answer, that's great. Correct answer is C. Why C? When we're talking about preparedness theory, first of all, we have to keep in mind, and sometime in examination you can find who proposed this particular theory. So this theory is presented by Martin Seligman. So Martin Seligman presented this theory and they suggested that humans are biologically predisposed to learn certain fear more easily than others, specifically those that are dangerous like snakes or heights. So according to Martin Seligman, we learn all those things very easily that is dangerous for us. This helps human being and this help as a psychologist, this help us as a psychologist to understand universal and rapid acquisition of fear, right? So if any specific emotions, more specifically if that is related to danger, and if we are talking about the universality, or if we are talking about those specific fear that is dangerous and that is universal, we can explain them by this particular theory, preparedness, that is presented by Martin Seligman. So correct answer is C. Question number 44. Ravi experiences deja vu while visiting a new city. Although they have no memory of being there, what is the most likely explanation? Option A, temporal lobe spike. Option B, retroactive interference. Option C, repression of trauma. Option D, semantic encoding failure. I hope you all will be aware about the deja vu. What is deja vu? Right? And you will be aware about all these options. But one more effort that you have to do. Whenever I am presenting any question and I am saying, okay, option A, B, C or D is the right answer. So usually I am not tackling rest of three. But after this particular session, you can write all those pointers, all those options in your notebook, or you can revisit this particular video after the session. And then if there is an R, if you are finding any unknown options and unknown points, you have to go with that particular point. You have to do effort to understand what this particular point mean, no matter that is the right answer or not, right? So you are mentioning your responses. So yes, Ramesh Kumar, Bubai, Arjun, you are mentioning the right answer. Not that is not the right, but you are mentioning the answer. Okay. Then Sanjukta, you are mentioning it. Okay, fine. Roshan, you are mentioning your responses here. Okay, the correct answer is A, temporal lobe spike. Now we have to understand why we are choosing this, why we are saying temporal lobe spike is the right answer. First of all, in brief, we will try to understand what is deja vu. We all are aware, right? But we will take a brief look into it. Deja vu is a strong feeling that current experience already happened earlier. So whenever you will be in a new situation that you have never attended or never visited, you will feel that it happened earlier, right? So this is deja vu. Now the answer is, I am mentioning temporal lobe spike. Why? That is the most likely explanation. If I am having all these options, the most likely explanation and most likely correct response will be temporal lobe spike. Because whenever we are talking about temporal lobe, particularly the medial part, in medial part there will be few specific organs, like first medial part of the temporal lobe. The first organ that we are associating to it, that is hippocampus. Hippocampus. Along with hippocampus, we can say parahippocampal gyrus. Parahippocampal gyrus. Parahippocampal gyrus, right? These are the two major part of medial part of temporal lobe. And this specific part, hippocampus and parahippocampal gyrus, is associated with memory and recognition. So whenever there will be abnormal activity in this particular area, they can trigger deja vu experiences. That's why what kind of options we are having, according to all these options, we can choose temporal lobe spike. But again, one strategy I have to mention here, this answer I am choosing, this option I am choosing just because I am having these options here. So next time, if I am having options like temporal lobe along with other options, so might be my answer will be changed. So this option is relevant in these particular situations when we are having these combinations or combinations. So when combination will change, then might be possible I have to choose another right option that will be correct. Question number 45. You believe jogging is healthy but rarely jog yourself. This inconsistency likely causes a fundamental attribution error, cognitive dissonance, obedience, mere exposure effect. Right? Which one is the right answer? Question is, you believe jogging is healthy but rarely jog yourself. This inconsistency causes A, fundamental attribution error, B, cognitive dissonance, C, obedience, and D, mere exposure effect. Right? Correct answer will be B, cognitive dissonance. Cognitive dissonance occurs when a person holds two or more contradictory belief, attitude, or behaviors. That contradictory belief, attitude, and behavior creates psychological discomfort. To reduce this particular discomfort, people usually try to change their behavior, they try to justify it, right? Or they are trying to alter their beliefs. So whenever there will be more than one, or we can say individual hold two contradictory belief, attitude, and behavior, we can say that is our cognitive dissonance. So according to the statement that we are having, we can say cognitive dissonance will be right answer. Question number 46. A psychologist uses Eysenck-Penn model to evaluate a subject. The individual shows high psychoticism but low neuroticism and extraversion. Which of the following behaviors is most likely? Option A, withdrawn but emotionally unstable. B, sociable and anxious. C, creative, impulsive, and emotionally stable. And D, introverted and conscientious, right? Conscientious, introverted, and conscientious along with all these options. We all will be aware if you read Eysenck model. So we can say according to Eysenck's Penn model, here you can see the pen, P-E-N. So P refers to psychoticism, E, extraversion, and N, neuroticism. That's why we call them PEN model. So psychoticism associated with trait like aggressiveness, creativity, impulsivity, and non-conformity. When we talking about extraversion, extraversion means how outgoing and social a person is. This is connected to extrovert and introvert. So extraversion means how outgoing a person is in social situation. Neuroticism is connected to emotional instability and moodiness. So here you can see we are having these options. So whenever this option we are having, all these options we are having, so we can say correct answer will be C, creative, impulsive, and emotionally stable, because we have to choose the individual shows high psychoticism. So high psychoticism is likely to be creative, impulsive, and non-conforming. High psychoticism, whenever there will be high psychoticism, they are likely to be creative, impulsive, and non-conforming. If suppose that if we are having the same statement, but at the place of high psychoticism, if we are having low neuroticism, let's take an example. So low neuroticism is emotionally stable. If there will be low extraversion, that means that will be introverted or reserved. So what options we are having here, accordingly we can choose the option. So here you can see the individual shows high psychoticism. So high psychoticism is connected to creativity, impulsivity, and non-conforming behavior. So we can say C is the right answer, creative, impulsive, and emotionally stable. That will be the right one, right? This one is the most close with high psychoticism, right? According to all other options, what kind of options we are having, right? Whenever you are going with all these options, then you can find C is the closest one. (47) Despite personally disagreeing, Aisha gives a wrong answer during a group task because everyone else does. This demonstrates obedience to authority as style conformity, social facilitation, and the bystander effect. These kind of easy question you can find in entrance, right? I am considering this is the easy one, right? But this kind of question will be there. Many individual doing mistake in this kind of easy question as well, right? So whenever you are going to participate in any entrance, no matter that question is too easy, that looks easy, you have to read a statement, you have to go with all the options, and then only you can make a decision what will be the right answer, right? Here you can see all these options we are having. The correct answer will be as style conformity. This scenario that you can see in the statement, this scenario closely mirror the classic as conformity experiment, where participants gave obvious wrong response. They know what is the right response, but they are going and they are choosing wrong answer to respond just because they don't want to present themselves totally different and outsider from that particular group. So in as style conformity, as explaining how individual will change their response in group pressure. So accordingly, correct answer will be B, as style conformity, because here you can see Aisha gives a wrong answer during a group task because everyone else does. So if they are observing everyone mentioning the wrong answer, so they are aware what is the right answer, but they don't want to present themselves as outsider, right? They are also choosing the wrong option, wrong answer to respond. That will happen in as style conformity. Question number 48. Before moving ahead, you are mentioning your responses. Okay, SHYLZ. Okay, I'm not able to pronunciate how to pronunciate your name, but you are mentioning your response as as style conformity. Yes, you are right. Buvai, you are mentioning your response. So yes, you all are responding correctly. Okay, fine. So now here you can see question number 48. In a hospital setting, patients who view their pain as a challenge to overcome rather than a threat tend to recover faster. This demonstrates which psychological factor in stress response? Catastrophizing, B. Cognitive appraisal, C. Defense mechanism, and D. Stress inoculation. What is the right answer? Right answer will be cognitive appraisal, B. So if you are thinking cognitive appraisal, so yes, you are right. B is the right answer. What is cognitive appraisal? Cognitive appraisal is presented by one of the great psychologists. This particular concept is presented by Richard Lazarus, right? And we are referring cognitive appraisal in a way where we are trying to understand how we interpret or evaluate a situation. What I mean to mention here, cognitive appraisal mentioning how you are interpreting the situation that can create a stress in us. Suppose that if any event happened, are you going to consider them threat or challenging? If you are considering them threat, so there will be higher level of stress. If you are considering them challenging, little milder. And if you are considering no threat, no challenging, it's easy for me, it's okay, it's natural, I'm not in threat, then we don't face any kind of stress. If we are in stress, already we are in stress because we explained them as dangerous, then we are trying to understand that we are having capacity to deal with it or not. If you are saying, yes, I am having capacity to deal with it, then you will be able to manage them effectively without stress. But if you are saying, no, I don't have capacity. So whenever you are considering something, right, as here you can see threat, then chances are higher that you will be in stress. But if we are considering this is challenging thing, you are taking them as a challenge, then relatively chances to develop stress will be lower. That's why I always mentioning whenever you are reading psychology, whenever you are going with any theories, and if you are not understanding any theories, any principle, take them challenge. Whenever you are facing any difficulties while reading and while moving with entrance preparation, take them challenge, because whenever you are considering that is a challenge, not a problem, right? So unconsciously, subconsciously, even consciously, right, we are taking that particular issues differently, and we are struggling to come out from that particular challenging situation because we consider them challenge, right? So whenever any individual considering this is the challenge to come out from this pain, so they will able to recover faster in comparison of when any individual considering that particular situation as threat. So correct answer will be B, cognitive appraisal. Question number 49. An experiment finds a high correlation is 0.85 between two personality scales, but the item on each scale seem to measure different traits. The issue is likely with option A, predictive validity, option B, discriminant validity, option C, internal consistency, option D, concurrent reliability. And the correct answer is B, discriminant validity. Why B is the right answer? Here you can see this statement, right, give you the enough idea why that will be the right answer. Here you can see an experiment find a high correlation, okay, correlation is high, but here you can see the item on each scale seems to measure different traits. So if correlation between, right, two personality is too high, but at the same time, right, those two things measure different traits, those set of items measuring different traits, so we can say there will be problem in, right, discriminant validity, right? B is the right answer. Question number 50. Question is, a woman avoids public transportation due to fear of being unable to escape if she panics. She avoids crowded places entirely most likely condition from these, right? What is the condition, right? Appropriate condition from these options. Option A mentioning social anxiety disorder, option B agoraphobia, option C generalized anxiety disorder, option D panic disorder, right? So just let me know in comment box what is the right answer if you know about it. Read the statement carefully because that could be confusing, right, for a few individual. Question is, a woman avoids public transportation due to fear of being unable to escape if she panics. She avoids crowded places entirely. Most likely condition is option A social anxiety disorder, B agoraphobia, C GAD, and D panic disorder. What is the right answer? Right answer is B agoraphobia. Right answer is B. Why? Because when we talk about agoraphobia, that is characterized, and you can find that is characterized by fear and avoidance of situation where escape might be difficult or help may not be available, right? Individual thinks that it will be very difficult for me to escape that particular situation and help will not be available if I will be in panic or there will be panic like situation. So when panic like symptoms occur, I will not get any kind of help. So common example or common situation where individual having problem, that is public transportation, crowded places, and open or enclosed public spaces, right? So agoraphobia is the right answer. In this case, when we are having these kind of statements, you can see a statement mentioning C is avoiding public transport. C is avoiding public transportation, public transport and crowded places. Here you can see public transportation and crowded places. They avoid it. The reason is fear of being able to escape if she panics, right? They are having this particular sense. They are having fear that I will not be able to escape if there will be any kind of problem. So this aligns almost perfectly with the clinical description of agoraphobia, B. That's why we can say B is the right answer, right? I am very hopeful that you learned something new. And as I told you in the beginning, if you are having any doubt, any queries, you can always reach to us. So Hudaya, well done. You are mentioning answer. Hello Seema, nice to see you here. Vasundhara, you are mentioning responses. Tessa, yes, well done. So Bhubai mentioning, sir, any update on release of WinPass admit card? Bhubai, right now we don't have any updates, but be on our social media platform. You can follow us. You will definitely get update when they will release admit card. We will try to update you as quickly as possible. So yes, so hopefully you learned something new. If you're having any doubt from this particular things that we already talked today or we already discussed today, if you're having any queries apart from these, you can mention in chat box, and you can also give your feedback in the comment box, what kind of changes we can do and what kind of things benefiting you, all these things you can mention there. Guys, as I told you in beginning, I already mentioned in the beginning, if you are doing preparation for any entrances, that's not easy. Just because we have to understand that is competitive exam, right? If there will be 10 seats, approx 100 individual will reach there. We have to beat 90 individual in a row, then only we will be able to get in. But believe me, that is not so difficult, right? Till this particular, these time, whenever we are talking or we are taking this particular live session, cracking this exam is difficult, is challenging, we can say. But with the right strategy, with your consistency, passion, with your interest, you will be able to get success, right? Why I'm saying that is difficult, challenging, but you can crack it, because whenever you are comparing, right, this exams in psychology, and after, specifically we can take example of PsyD, PDCP, M.Phil in clinical psychology, or MA in clinical, that will begin from 2026. What kind of power you are getting, and how much power you get after being a clinical psychologist, after being a rehab psychologist. If you compare their entrances, right, to other entrance in which we are not getting that much of power, then you can find it's fine, right? What I mean to mention here, exam is difficult, but that is rewarding. At the end, when you crack these exams, when you get your license, when you enter in this particular field, you feel very satisfied, because you helping individual directly. You will be responsible to impact someone's life directly, and that is very satisfying, right? So competition तो होना ही चाहिए ना. If you are getting that kind of responsibility where you will impact someone's life directly, and mainly, right, you are going to help someone with their health, so competition तो होना ही चाहिए. But yes, that is much rewarding. So if you are doing preparation, just understand it कि challenges हैं, no doubt, right? That exam will be challenging, but if you will maintain your consistency, then definitely you will reach where you want to reach, right? And in this journey, if you are having any doubt, any queries, and you think we can help you, so you can contact us, right? So that's all for today, right? See you in next class.